Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone. Before I go start the case study, I have to tell you, if you guess any of these two cases, EF is almost normal, I am afraid that whatever you learn about the visual guessing EF is wrong. In this case study, I'm going to represent four cases and I want you to try to guess how much ejection fraction is. And all your guessing is correct or not and why. And give you those tips and pitfalls in eyeball guessing and generally speaking, LV function concept in echo. What does mean when we look at the images when we want to evaluate it? What things we have to consider about our view, about our measurement, about our guessing, and generally speaking, evaluation. This one, first case, is a 65 years old lady without any history and any risk factor, came to the emergency with chest pain. Most of them radiated to the left arm during working on the ground, and they did angiography, coronary angiography, and I'm not going to tell you what they do and what was the finding. Just based on these two, one of them zoom in, one of them regular on plaques and M-mode. Based on this, can you guess how much is ejection fraction and if you are right or not? Here we have case 2, a 58 years old guy came with the chest pressure, nausea, sweating, and again no any risk factor. Just patient was on their hypercholesterol treatment. Here we have on plaques view, and here we have 2D measurement on plaques. As you can see, diastolic and systolic. Is your visual guessing is correspond and match up with the technique that we measure on diastole and systole? Is that right or not? Is match up or not? Second, is this technique is correct, the measurement is correct or not? First. Third, if you assume that measurement is correct, do we rely on this measurement and technique and give us here, for example, number was 20%, and why yes or why not? Here we have case number 3, a 67 years old without any history, came with chest pain, and we did this echo. You can see on the plaques and PSAX and M-mode. How much you guess, and is that right or not? And just that's it. Let's see how much you guess. Here we have case 4, a 64 years old guy with history of CABG, aortic valve replacement, came with the cardiac arrest, and they request echo. This is the patient almost didn't have any plaques and apical. We just got it some off-axis this view. How much you guess this patient ejection fraction? If you answer to any of them, EF normal or over normal, all of them is wrong. None of them has normal EF. Let's go to the answer. The first rule,